This lecture is about the sciatica. So sciatica results in the low back pain that travels into the right or the left leg. There is an irritation to the sciatic nerve which originates in the buttock and the gluteal area, which can travel down to the leg. Sciatic nerve root is made from the five nerve root in the lumbar spine. So two from the lumbar and other from the sacral region, which is the lower back. This is the longest and the largest nerve in the body, starting at the back of the pelvis and runs from the back under the buttock and down your leg, ending at the foot. Sciatic pain occurs when there is agitation, inflammation, pinching, or the compression of a nerve in a lower back. There is a mild to severe pain is experienced anywhere along the path of a sciatic nerve, that is from the low back to the hips, buttocks, or down your legs. So pain from the sciatic nerve compression may feel like that there is a dull, sharp, electric burning or a stabbing sensation. It may cause muscle weakness in the legs, foot. There's a numbness along the root of a sciatic nerve. There's a tingling, pains, and needle type of sensation in the foot and the toes. And the pain is more worse and severe in leg as compared to the lower back. In some cases, there may be no pain in the back, but there is a pain in your lower limbs. Pain gets worse when you sit or stand for the prolonged period, and a force or a sudden body movement like cough or sneezing can make the pain more worse. So, in sciatica, the pain is more when the person flexes or when the person sits for the prolonged period. So when you make the patient to do flexion repetitively, the pain experienced at the L4 and the L5 region may diagnose a person with a sciatica. So this is sciatica nerve root which generates from the lumbar region L4, L5 and the S1, and it goes to the buttock region and then it goes to the foot. So there are many causes which can lead to the sciatica, which are discussed in the further slides. That there may be a disc bulge, herniated disc. If the disc bulge at this level, it can impinge the nerve root, or if there is a piriformis muscle in the gluteal region, buttock region, and if this muscle gets inflamed, if this there's a muscle spasm there, this can also impinge the nerve. There are many causes which can lead to the sciatica. The most common is the slip or the disc herniation. If there is any repetitive movement, or if there is any sudden movement, or if there is an heavy weight lifting, and there is a sudden pain when you lift an object in any heavy object, that pain can lead to a sciatica. So cause of sciatica is the herniated or a bulging disc. So this acts as a cushion for the vertebra and transferring load placed on the spine from one disc to the another. So in bulging, gel-like center of a disc, which is a nucleus pulposus, remains intact within the annulus fibrosus, but can extend the outer wall enough to press on the nearby nerve root. So and the herniated disc occur when the nucleus pulposus breaks through the annulus fibrosus, which comprises the nerve root and causes the sciatica. So disc bulging and herniation more frequently occur in the lumbar spine as compared to a cervical spine because this supports the entire body. Sudden jerk bending, forward bending causes the pain, early morning pain, or if the person's cough, the person sneezes, this also lead to some type of patient feels pain in the lower back when the person cough. This may give a clue towards the sciatica. So if a person has a sciatica, forward bending may be difficult for that person because it will impinge the sciatic nerve, and sudden jerking and a bending, like if a person lifts the weight, heavy weight, that can also impinge the nerve. And more commonly in the older population, there may be a degenerative changes with the age. So in a young, it may be lead to a sudden, but in an older population, it may be due to the degenerative causes. Then there is a spinal stenosis, which refers to the narrowing of a spinal column. As the space becomes narrow, vertebrae can compress the nerve, causing pain and numbness down one leg. The decrease in a space within the canal is typically the result of disc herniation, vertebral fractures, dislocation, trauma, bone spurs, and the tumor. Pain or cramping in one or both the legs when you stand for the prolonged periods of time, or when you walk, which usually eases when you sit or bend forward. So spinal stenosis pain is more when you stand for the prolonged period, and when you sit, that pain usually disappears. But as compared to a disc, the pain is more when you bend, when you sit for the prolonged period, but it eases when you stand. Right, this is a spinal stenosis where like this is a space more broad, but when there is a disc bulge or there is a spur, there is a tumor or anything else, it compresses your nerve. So this is a stenosis when there is a narrowing of a canal. Another is a piriformis syndrome. So piriformis syndrome is the name for the piriformis muscle and the pain caused when the muscle irritates the sciatic nerve, and the piriformis muscle is in the lower part of a spine which connects to the thigh bone and assists in a hip rotation. So its main function is external rotation and the abduction. Sciatic nerve runs beneath the piriformis muscle. Inflammation of a muscle can cause the muscle to swell and compress the sciatic nerve, and the muscle spasm may impact the people whose sciatic nerve runs through the muscle itself because the nerve gets squeezes as the muscle contracts. So, how you diagnose the sciatica? The most common test for the sciatica is the first one is the patient history, and clinically, you how you can diagnose is to perform the SLR and the SLAM test, the most common test for diagnosing the sciatica. So in SLR, tests include the patient lying in his or her back, like in the supine position. The patient will be in the supine position with the other leg flat on the bed. A pain encountered while lifting the affected leg usually indicates the sciatica. So there are different ranges to diagnose the sciatica, whether a nerve is involved or whether other structures of the hips are involved or SIJ is involved. So there are different ranges. Another is a slump test, which may be performed in a sitting position. With the hands behind the back, the patient bends forward at the hip, the neck is bent down with the chin touching the chest, and one knee is extended to the degree possible. If pain occurs in this position, the sciatica is possible. So this is the straight leg raise test, which is the SLR. So there are different degrees. Like when you lift the leg, to 30 to 70 degrees. So tension and a movement sliding of a sciatic nerve progress from the greater sciatic nerve and distal to the intervertebral foramina proximally, and a tension to the sciatic nerve is applied at this level. So most common range is 60-70 degree when a patient feels pain that can diagnose the sciatica. And if the patient feels pain on a greater than 70 degrees. So that is not the nerve. There's maybe an other structures that may be a SIJ joint involved. Another is a slump test. So in slump test, the patient is sitting and these all other steps. He bends, he bends the head and the chin will touch to the chest, and then he will flexes the lumbar spine. At the same time, he extends the leg. So there will be a pain or there will be a tension feel while the patient while performing the slump test. Next for is the exercises for the sciatica. So different exercises, extension and flexion back exercises, strengthening, functional training, nerve glides, joint mobilization, and joint manipulations. The most common is the extension and flexion back exercises. So it depends whether the symptoms are the acute or the chronic. If the pain is just localized to the back region, like for example, if there's a disc herniation and the symptoms are just localized to the back, so we go for the extension protocol. But if the symptoms are going towards the buttock and then to the thigh and then to the leg, so it means that the condition has become the chronic. So then you go for the flexion exercises. Then the strengthening exercises, go for the isometric, go for the isotonic exercises, functional retraining, nerve glides are given, joint mobilization, and you go for the joint manipulation.